All right, so Dr. Hoover, thanks for your time today. So in selecting Cardio IQ for your practice, what was the big motivating factor behind using Quest?
Well, personally, I suffer from heart disease, and the Cardio IQ assisted me at finding out that I carry a mutation that is actually called lipoprotein A, and that is part of the Cardio IQ. So since I started using that specific agent, I have discovered a lot of my patients that have high risk of coronary disease, patients that are actually young, have a mutation. So the benefit of knowing as a doctor and giving that information to a patient is, obviously the next question from a patient's standpoint is, does this run in the family? And then who needs to be checked? My parents, go back generations and go forward generations. So actually in my personal case, I discovered my 16-year-old has lipoprotein A mutation. My mother has lipoprotein A mutation, and my grandmother passed away 6-7 years ago from an arterial occlusion. So how do I take this, right? And this is what I told my patients: whenever you get a test done, you need to be ready for the answers. So the way I see it as a patient personally and as a physician is prevention. So you're lucky enough to know that there's something in your body. How do you prevent it from, basically becoming active? Because everybody's full of mutations, but how do you prevent that mutation from killing you and causing disease? So that's why I start, basically, myself and my patients, I recommend they go to a nutritionist, they eat healthier, they exercise, they might need to be on medication to prevent, the cholesterol from going higher. So the Cardio IQ has other components, not just the lipoprotein A, has a cholesterol profile, which is very important. We all know LDL should be less than 130s. If you have high risk of coronary disease, it should be less than 70. You have the triglyceride, it should not be more than 150, the HDL, and the total. But also we have homocysteine level, some inflammatory markers, and the insulin resistance. So
that's a powerful story, so thank you for sharing that. What do you find most useful about selecting insulin resistance with SCORE for patients?
So insulin resistance for me was definitely a new thing to learn as a physician. Obviously, they didn't teach me any of this in medical school. Some of my endocrinologists in my group also don't even knew about insulin resistance. That was something that you can check in the lab. So the old traditional way, we would look at glucose and hemoglobin A1C, but now we're noticing that there's a population of patients that their insulin levels is high, and obviously by having an insulin that is useless, it's just there but not really functioning, you're going to become diabetic. So again, how do you see this data? It's preventive. If somebody has a high insulin resistance above 30, you kind of want to start already having that patient go see a nutritionist, exercising, eating healthier, possibly start looking for the risk factors, looking at the cholesterol profile, making sure there's no family history, stop smoking. So all the components that together lead to a heart attack or stroke. So for me, it's great to be testing all my patients for insulin resistant. That's actually more common than lipoprotein A mutations or any other mutations in a lipid family history. So it's great. That's my recommendation.
Excellent, thank you. And what would you tell your colleagues if they were to call you and say, why are you using Cardio IQ?
You went into medicine and you want to help people. So the more advances in medicine there are, we need to stay with the flow. So this is something that was available a few years ago, and I kind of jumped on the wagon and started doing it on patients. I feel like I have saved a lot of life, including my own family members. So I definitely recommend doing Cardio IQ on those patients that are high risk, that are hyperglycemic, that meet certain criteria. I want to recommend it on the general population. I wish it was covered by all insurances, but definitely on the patients that are high risk, I definitely recommend doing it.
Well, you brought up a good point. So not everything's fully covered by insurance. So what's been your response to patients when they talk about, hey, I'm receiving a $40 bill or $50 bill? How do you typically handle that? To be
honest with you, in our office, we see between 300 to 500 patients a day. We probably run this Cardio IQ in at least 200, 250 patients. Barely any complaints regarding bills. Like you said, it's only $40, $50. I think as a physician, if you explain to the patient the value of this test, it's not going to be questioned. And
Excellent.
I never really received major complaints. And the best thing about Quest is that you guys are very responsive and helpful, whenever there's any question from the patient.
Great, thank you. Appreciate it. That's
You're welcome.
perfect.